Hi everyone, welcome to part 2. So now we're going to talk about some of those things. Oops, sorry about that. Okay, so when we're looking at influences on IQ, that we know that there are multiple regions of the brain that are involved in intelligence, and they all kind of play a really important part. Again, the heritability of IQ is estimated, again, like I mentioned, at about 50%. But there do seem to be multiple environmental influences that can really factor into IQ. So, for example, education has been shown to increase, or access to education and quality education has been shown to increase IQ up to 7.5. We're talking about standard points. Adoption can result in a 10 to 12 point gain or loss, depending on if it's in a more enriching or less enriching environment. Again, we also know that IQ has increased in developed nations by about 15 points in 50 years. Later in here, or at the very end, I'm going to link you guys to a TED Talk by James Flynn, who is the author of this phenomenon called the Flynn effect. And actually, your second discussion question focuses on watching that talk and kind of talking about that and what that means for measuring IQ and specifically our population. All right, so again, there are many environmental influences, and remember, there's not one in particular that seems to be more prevalent than another, but here are just some examples of things that can impact the expression of IQ. So infections and illnesses in mothers, drug use, prenatal stress, and when we're talking about prenatal, that's occurring around the time of birth or injury. So a combination of perinatal complications like anemia, high blood pressure, hemorrhaging, diabetes, produces a six-fold increase in the risk that child will be placed in special education and can be at risk for having intellectual disability. Low birth rate is also really, really important when we're looking at that. That's why there's usually such a huge emphasis putting weight on babies if they're born of low birth weight, specifically below about 3 pounds. Nutritional stress can lead to learning difficulties by disrupting the central nervous system, specifically brain development. And that can be also during pregnancy, so when the mother is pregnant, and additionally after birth. Intellectual environment and stimulation at home, that's really, really important. When we're looking at persistent low SES, so socioeconomic status versus transitory, those that come from that live in poverty for longer, that has a much larger effect on IQ than if you're just in and out. Schooling plays a minor role, and years of school completed and IQ have a really high correlation. Stability of IQ, so can it change? In general, it's a pretty stable construct, but there are many things that can certainly play into that and influence that. There can be different measurement factors, the age of the test, genetic factors, and environmental factors. Tests become better predictors with age. So again, when you're looking, that's why especially when you're making diagnosis for intellectual disability, usually you want to do that after age 5 because that's when they get more stable. IQ scores are pretty good at predictors of school performance. And like I mentioned before, intellectual disability diagnoses should not be made solely on an IQ score, and certainly not before age 5. So here are just some additional considerations when we're looking at interpreting IQ scores. The first one is clinical judgment, and we'll talk more about clinical judgment later on in the semester. But in general, what clinical judgment pertains to is kind of a clinician's ability to make judgment calls when things may seem borderline. This is based on schooling, experience, and consultation with other colleagues that are used to doing assessments, specifically for individuals with intellectual disability, making sure the person understands the standard error of measure, and that's taken into account. And remember, that's really important when we're applying IQ scores. And also weighing multiple factors, including age of onset, reliability of reporters, effort of the individual during the IQ test. Also considerations, measurement error. So in general, our tests are really good at doing what they're supposed to do. But An IQ score is just an estimate. There's no way we can ever know anyone's true score. And some of the measure or some of the error is already factored into the score. And that's why you get a range of plausible values or a confidence interval. But there are other things that can certainly happen. So it's really important that you have good information about other ways that error could be factored into the score. Variation in test performance. This can have to do with level of effort of the day, which goes into the examiner's, the cooperation of the test taker. So did the person put forth their best effort? In general, there are some things like, the time of day, if someone's hungry, if they're just not really feeling it, that can really lead to error in score. But there's really nothing, so there are lots of things I always say that can happen that can deflate an IQ score, but there's not a lot of things that we can do to inflate a score. You can't sprinkle, unfortunately, some magical dust on someone and have them do a lot better. So it's important that you really control for making the person at their best, and we're getting a maximum sample of behavior. Also the examiner's behavior. So when I'm giving an IQ test, it's really important that I'm bringing my A game and that I'm being really positive and motivating and not giving off any nonverbals that may deter a person from giving their best. Personal and environmental factors, again, that just can be how they're feeling that day, or maybe how the environment is. Is it too hot? Is it too cold? And also important to notice that standard error of measure is not the same across age, test, subgroup, so type of individuals. So this pertains to individuals with intellectual disabilities. But that standard error, the measurement error is usually 3 to 5 points. And make sure you report your confidence intervals within your score. And again, that's that range of plausible values. Making sure that test fairness is taken into account, making sure that you pick an assessment that matches an individual's verbal abilities and their expressive language, and additionally is sensitive to ethnic diversity if people come from different cultural backgrounds. So additional considerations, comparability of scores from different tests. So IQ scores are different across versions of tests. So for example, one of the tests, the Wechsler series, the WISC-5 right now for children, comparing scores from the WISC-5 to the WISC-4 are not exactly appropriate to do. So it's important that you understand what the renorming was and make sure that the most up-to-date score is used. Additionally, there's something called practice effects, which means that a person, the more we take IQ tests, the better we get at them. So it's generally recommended that you wait a year between giving someone an IQ test. Again, so this is important when we're looking at diagnosis and making sure that people with intellectual disability aren't given IQ tests too frequently. So extreme scores. And when we talk about extreme scores, we're talking about our population because they obtain extreme scores on the lower end of the normal curve. In general, tests are best used with persons that fall 2 to 3 standard deviations from the mean. And that could apply to our population, but if we've got somebody with real severe cognitive impairment, the scores get less reliable because there's a smaller number of individuals in that norm group. So when you're seeking initial diagnosis, it's generally considered best practice to seek more data points, so more than just one IQ score for an initial diagnosis. And then also determining a cutoff. Again, generally it's 70, but there's no real fixed cutoff, or rather there shouldn't be. And this is really important when in Module 3 we'll talk about Atkins decisions and making those decisions, because clinical judgment is really important to employ here to make sure that you're interpreting the score appropriately and that the score alone is not used for diagnostic purposes. There are many other pieces, including adaptive behavior, the person's educational history, and age of onset that should be taken into account. And knowing that, unfortunately, the definition is the cutoff is pretty operational in most states, which means that it's pretty hard and fast, and it varies from state to state, which can make it a little bit tricky if people move from state to state. So additional considerations. That's not good, not covering anything. The IQ score is important. IQ tests, while not perfect, they are pretty good at doing what they're supposed to do, but making sure that they're reported with their corresponding confidence interval and diagnostic decision making should be a process and not just based on a statistical calculation or an IQ score. Making sure that the assessor, the person that's giving the IQ test, knows what they're doing, making sure that they understand the 5 assumptions that apply to the definition of intellectual disability, that they're really familiar with the AAIDD and not just the DSM and just giving IQ tests, all really important. Additionally, making sure you pick the right test. Making sure that the test is individually administered. Again, I'm sure you guys have seen, if you put anything into Facebook or Google about IQ tests, it'll tell you all sorts of stuff, like Justin Bieber's IQ is like a gabillion or something, and you can take this IQ test. And those are not standardized, good IQ tests. IQ tests are individually administered by a clinical or a school psychologist only. They're the only ones that are able to do that. And they should yield a general IQ score, a standard score, and you should be able to understand the confidence interval and percentile ranks. Floor and ceiling effects apply to populations on the tail end of that normal curve, so people that get really high scores or really low scores. And what this means is that there can be floor effects when there might not be enough easy items for an individual. And ceiling effects means there might not be enough difficult items on a test for an individual. So the floor effect piece can really impact our population, especially if we're really low functioning or they're really young. We may not be able to get a valid IQ score because maybe they're not able to do anything on the test. So important to supplement with other tests like developmental tests and also nonverbal tests when necessary. And then this Flynn effect here. So this TED Talk here, I'm not going to watch it in here because it's about 10 to 15 minutes in length. So I'll let you watch that at your leisure, but make sure you watch it because it's important for discussion 2, which is a prompt from me. But what it shows is that our IQ scores are increasing, and in general you can multiply the years from the test was published by 0.33 and then add it to the IQ score. Some will argue it's not that easy, but I'll let James Flynn tell you a little bit more about that since he's the authority on that. But the take-home message is to make sure we're always using the most up-to-date assessments due to the possibility of the Flynn effect. So here are some bottom lines just to take home when you're thinking about IQ and intelligence tests that measure them. So IQ tests are, again, like I said, are good at what they're supposed to do, and they can predict successes in employment and in education, and they're standardized, or they should be. Don't take one online. You can't. But they only provide a limited understanding. They're just a snapshot of that person's performance on that day, and they can be misused. They're limited in their prediction of non-test or non-academic intellectual activity, so it doesn't stop there. IQs are not fixed, especially from birth to 5 years. We see a lot of growth, or we can see a lot of regression during that time period based on many things. It's important to note that intelligence tests are culturally loaded. So if you look at IQ tests that we take in the US, there's a lot of items that if you weren't a citizen of the US, you might not know some of them. But in generally, they're not ethnically or racially biased, or they shouldn't be, and making sure that you understand the test construction to make sure that they're not that way. And intelligence tests do provide moderate stability over the lifespan. So if you get an IQ score when you're 10, you probably would get the same IQ score when you're 20, or you should. And if there's a huge difference outside of the confidence interval or that range of plausible values, want to make sure that the test was valid and that maybe there wasn't some type of head injury or something that could lead to a regression. All right, friends, thanks for tuning in again. If you have any questions about the material from here, please let me know. Make sure, again, you watch that video on James Flynn because that's important to do your discussion 2 prompt from me. Let me know if you have any questions.